as we improve the multiple myeloma treatment, I'm sure that we will improve also this subset of patients. But if you want to selectively target these patients, you have to target NSD2 or the NSD2 effect on the genome. So in one of the talk today, we learned that there are some hypomethylating agents that can help to revert the biology of the cells from these patients, from 14 positive patients, and there are also nowadays NSD2 inhibitors, and some of them are at this moment in clinical trial alone or in combination in phase 1 trials. So I think that in the future, adding an NSD2 inhibitor to the therapeutic armamentarium that we have available in multiple myeloma would be very important in this subset of patients because it's specific.